you know, kind of
confidence, for them to be comfortable enough to have confidence in what I'm teaching them and showing them and creating for them with their oral health.
Now, and you guys do a great deal of instruction before, during, after, because it's important, isn't it?
Oh, yeah, but never lecture.
Right.
We'll teach, but we won't lecture.
What are some of the things that you teach before, during, after?
I've found lately, after being in practice for 17 years and watching my patient population mature as I have, that I need to look for what's going to happen down the road for them, because there's so much going on in their world right now that it's hard for them to even conceptualize what they need to have happen to stay healthy dentally in their future, in their old age, basically.
I wouldn't doubt. I mean,
yeah.
I think about the difference between where where dentistry has been, and then now I know that there are a number of new tool techniques, platforms, processes.
Oh, and they make my job easier. The technology available today, it enhances the result for the patient, but it also just makes it easier to accomplish what.
Let me do this. I know we've got a break coming up, so I want to make sure that, no, it's all good. Because the thing that we want to do is we want to make sure that we give honor to who's, to certain things. But we'll be right back right after this with the Business Spotlight. And welcome back to the Business Spotlight. It's your host, Patrick Dewar. My guest today is Dr. Mary Swift, and she is a cosmetic dentist. And when I say that, that's well, I don't even know if you would understand that much, because not many of us really go for cosmetic dentistry. A lot of insurance companies don't pay for that, but these things are amazing. The stuff that they're doing is cutting edge, and the type of client that really needs that is something that I really want to get into. And I know that as we move into this, I want to look at what you guys are doing that's so different, what you're doing to create the success you're having, Mary.
When I look at that question and try and look at my practice, I think I have a good grasp of what technology I should invest in to enhance the outcome for the patient. Dentists are famous for their toys, and their gadgets. And you can spend money on technology that you think is fun, but in the end it really didn't accomplish a lot for the patient. I've got in place digital software imaging that allows me to virtually straighten people's teeth on the computer and show them what the outcome could be.
Wow.
And that helps. If you can see what it's going to look like, it makes that decision easier.
Well, because so many times people can't visualize it at all. They look at their mouth and you just go, "What can you visualize? Straight teeth?" And they go, "Nope."
Yeah, Invisalign is an amazing technology that's out there.
Invisalign.
Invisalign, invisible braces. It was developed initially for people that had braces when they were a teenager, but they didn't wear their retainers. Things kind of crowded a little bit, and Invisalign unraveled that. The technology has advanced in the last 10 years that it's been available, that now we can use it for a number of different situations.
When you say invisible braces, I can't see them.
Exactly.
How?
It's a set of little clear trays. They call them aligners. And those trays are worn, each tray is worn for 2 weeks at a time. Each tray moves a little bit, then you put a new tray in, moves a little bit more, a little bit more. And because the old braces that used to be